Hello everyone, I'm Anas Al Ubaidi, and the topic for this session or the topic for this lecture is pulmonology, SOAP, so templates and diagnoses slash plan guides, which is part of chapter 28, which is about review of cardiology and pulmonology scribing within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. Pulmonology focuses on the diagnosis and treatment of respiratory system disorders, which include the lungs, airways, and associated structures. This highly specialized field addresses a range of conditions from asthma and chronic obstructive pulmonary disease, COPD, to pneumonia, pulmonary embolism, and other complex diseases like interstitial lung disease and pulmonary hypertension. This complexity demands meticulous documentation to support effective care, reduce errors, and improve patient outcomes. SOAP SOAP notes, short for subjective, objective, assessment, and plan, are the backbone of effective medical documentation. They standardize the process of recording patient data into a clear, organized, and concise format. Such templates are especially critical in pulmonology as the discipline often involves intricate diagnostic workups, multidisciplinary collaborations, and ongoing management of chronic illnesses. Mastery of SOAP note templates is essential for medical scribes working in pulmonology. These records serve as a bridge between what is observed during clinical encounters and what is required for future care coordination. The subjective section captures the patient's self-reported symptoms such as wheezing, difficulty breathing, or chest tightness, which are pivotal starting points for diagnosis. The objective component adds measurable findings like spirometry results, chest X-ray, or physical exam findings such as abnormal lung sounds or hypoxemia. These pieces of information coalesce in the assessment section, a synthesis of clinical findings that supports a diagnosis or differential diagnoses. Finally, the plan articulates next steps such as initiating long-term oxygen therapy, prescribing a bronchodilator, or scheduling further tests. For scribes, mastering this structure allows them to facilitate high-quality care by ensuring every essential clinical detail is rigorously documented. This is critical in pulmonology, where omissions or inaccuracies in records can lead to misdiagnoses or treatment delays. Accurate SOAP documentation supports a team-based approach, equipping healthcare providers with the data they need to make informed decisions. For example, in a case involving suspected obstructive sleep apnea, the scribe documents not only the patient's reported fatigue but also the results of an overnight sleep study and notes the provider's plan to recommend continuous positive airway pressure CPAP therapy. The role of scribes goes beyond transcription. It extends to being the diligent ears and eyes that ensure all medical records are comprehensive and compliant. This requires a deep understanding of medical terminology, pulmonology-specific workflows, and regulatory requirements such as ICD coding and HIPAA compliance. Effective documentation also plays a key role in billing and coding processes, ensuring the provider's services are accurately represented for reimbursement purposes. Key points. Understanding the structure and purpose of SOAP notes in pulmonology subjective section. The subjective section is where patient-reported symptoms and medical history are documented. This section forms the narrative of the respiratory complaint and provides essential context for diagnostic reasoning. Example, a patient presenting with shortness of breath might mention worsening symptoms during exertion and chronic nighttime coughing. Documenting previous hospitalizations for asthma exacerbations adds depth to the case. Objective section. This section focuses on measurable and observable data collected during the clinical encounter. It includes physical exam findings, vital signs, and results from tests like pulmonary function tests, PFTs, chest x-rays, or arterial blood gases, ABGs. Example, the objective findings for a patient with suspected pneumonia may include fever 38.5 degrees Celsius, crackles, hair donor auscultation in the right lower lobe, and the chest x-ray showing consolidation. Documenting these objective markers supports diagnostic accuracy. And here is a summarized diagram summarizing the structure of SOAP notes in pulmonology. Assessment section, the assessment integrates both subjective and objective data to arrive at a diagnosis or differential diagnoses. It reflects the provider's clinical reasoning and prioritizes conditions to rule in or out. Example, for a patient with cough and hemoptysis, the assessment might state differential considerations include bronchiectasis, TB, tuberculosis, and lung cancer. Initial testing suggests bronchiectasis based on imaging and recurrent infections. Plan section here, the physician outlines the next steps in patient care. This could include ordering tests, prescribing medications, initiating a treatment plan, or referring the patient to a specialist. The plan must be clear and actionable. Example, for the above patient, the plan may include ordering high resolution computed tomography HRCT to confirm bronchiectasis, starting antibiotics for infection control, and ensuring follow up with a pulmonologist. And here is a diagram summarizing the clinical decision making process. Organizing patient encounters, streamlining documentation workflow. Scribes play a pivotal role in capturing the chronological flow of a clinical encounter. By documenting as the interaction unfolds, scribes ensure that no significant information is omitted. Example, during a patient visit for COPD management, the scribe can chronologically document the patient's complaints of an increasing dyspnea, note recent changes in inhaler use, record the provider's observations of diffuse wheezing on exam, and summarize the subsequent plan to adjust the patient's bronchodilator therapy. Utilizing specialized pulmonology note templates, pulmonology often requires specific templates to capture all aspects of care. Templates might include fields for spirometry results, smoking history, and sleep studies, ensuring no critical data is overlooked. Example, a smoker with chronic bronchitis requires documentation of smoking history, pack years, spirometry results, imaging findings, and therapy compliance within a tailored template. Supporting clinical decision making, enhancing diagnostic precision, scribes document key elements that aid the provider in clinical reasoning. This includes capturing subtle details on patient reported symptoms or integrated imaging results with clinical findings. Example, for a patient with pulmonary embolism, scribes note dyspnea, positive D-dimer test, and confirmatory ventilation perfusion V over Q scan results. This synthesis provides a clear diagnostic path. Highlighting pertinent positives and negatives, recording both findings that support and negate a diagnosis ensures balanced and informed decision making. Example, documenting that a patient with a suspected asthma has no family history of the condition and minimal variation in pulmonary function tests, PFTs, rules asthma out as a likely diagnosis. Tracking disease progression. Comprehensive documentation allows providers to monitor trends over time, especially for chronic conditions. Example, recording pulmonary function test PFT trends in a patient with interstitial lung disease helps the provider detect disease progression and adjust treatment plans accordingly. Ensuring comprehensive documentation, coding, and compliance. Scribes ensure that all ICD-10 codes are appropriately linked to the documented care. This not only ensures accurate billing, but also keeps records compliant with medical legal standards. Example, after diagnosis of obstructive sleep apnea, codes for polysomnography and CPAP initiation are linked to the visit for proper billing documentation. Avoiding common pitfalls, incomplete or non-standardized documentation increases the risk of errors. Scribes need to stay vigilant to ensure all sections of the SOAP note are complete and error-free. Example, forgetting to document allergy considerations during a medication change could lead to patient harm and errors in the continuity of care. Developing specialty knowledge. To document effectively in pulmonology, scribes must understand specialty terminology and diagnostic tools. Familiarity with tests such as spirometry, bronchoscopy, and thoracic imaging is critical for accurate documentation. Example, a scribe must know that a DLCO diffusing capacity of the lungs for carbon monoxide reduction could indicate early stage interstitial lung disease or emphysema. Pulmonology specific elements. Specialized testing. Documenting diagnostic studies requires attention to detail, as these often form the basis of the objective and assessment sections. Example, pulmonology specific tests such as pulmonary function tests, PFTs, ABGs, arterial blood gases, are overnight oximetry require detailed documentation to support the diagnosis of conditions like hypoventilation syndromes or pulmonary fibrosis. Multidisciplinary cases, pulmonary patients often require input from multiple specialists such as cardiologists, sleep specialists, or infectious disease consultants. Scribe documents integrated conclusions to maintain continuity and clear communication. Example, for a patient with sarcoidosis, the pulmonologist's recommendations for corticosteroid therapy must be integrated with the findings of a rheumatologist treating related joint complications. Summary tables. Here we have table on components of SOIP notes in pulmonology. Section, key purpose, example, importance, common mistakes. Sections, we have subjective, objective, assessment, plan, follow-up. Table on common diagnostic tools in pulmonology. Tool, purpose, example, use case, data captures, documentation, notes, tools, spirometry, chest x-ray, arterial blood gas, ABG, HRCT, and polysomnography. Sleep study. The sleep study. Table on documentation challenges and strategies. Challenge description, example, impact strategy challenges. We have missing context, ambiguity in data, overloaded information, disorganized records, diagnostic oversight. Here we have a table on pulmonology specific planning, plan element, description, example, value to patient care, common pitfalls. Plan elements, we have diagnostic tests, medications, interdisciplinary referrals, patient education, follow-up plans. Here we have table on multidisciplinary collaboration in pulmonology, specialty, role in pulmonology cases, example, documentation, focus, risk of miscommunication. Specialties, we have cardiology, rheumatology, radiology, infectious diseases, and sleep medicine. Then we will revise what we have covered via this lecture through some MCQs or multiple choice questions. Question 1. What is the primary purpose of the subjective section in a pulmonology SOIP note? A. To record test results and measurable findings. B. To document the patient's self-reported symptoms and medical history. C. To outline the provider's diagnostic reasoning and final assessment. Or D. To plan follow-up visits in collaboration with the specialist. The answer is B, as the subjective section includes the patient's personal account of their symptoms, medical history, and context for the current visit. This information sets the stage for understanding the scope of the complaint, which is essential for forming an accurate diagnosis. Question 2. Which is a critical advantage of using standard pulmonology SOAP templates? A. They allow providers to skip physical examinations. B. They ensure comprehensive documentation and foster continuity of care. C. They reduce the need for diagnostic procedures like spirometry. Or D. They limit the length of patient encounters to predefined time frames. And the answer would be B, as pulmonology SOIP templates organize information systematically, allowing all relevant data, including subjective complaints and objective findings, to be recorded for continuity of care and clinical decision making. Question 3. How can scribes enhance clinical decision making during pulmonology encounters? A. By providing interpretations of diagnostic test results. B. By documenting key findings and organizing pertinent clinical data. C. By prescribing medications based on symptoms observed. Or D. By choosing the appropriate specialist for the patient's care. So, answer would be B, by documenting key findings and organizing pertinent clinical data. Scribes play a vital role in capturing and organizing information that aids providers in diagnosing and managing respiratory conditions effectively. They ensure that all relevant data are readily available for decision making. Question 4. What is the significance of capturing pertinent positives and negatives in SOAP notes? A. It speeds up documentation by focusing only on abnormal findings. B. It reduces the provider's workload by excluding diagnostic impressions. C. It supports balanced and thorough clinical evaluations. D. It simplifies the differential diagnosis to one possible condition. Answer is C, as it supports as a supporting approach or method, as pertinent positives support the likely diagnosis, while pertinent negatives help rule out other potential conditions. This comprehensive approach ensures balanced documentation, aiding accurate decision making. Question 5. Why is documenting follow-up recommendations crucial in the plan section of a pulmonology SOAP SOAP note? A. It reduces the provider's need to perform physical examinations. B. It serves as verification for billing without documenting procedures. C. It guides ongoing care and ensures consistent patient management. Or D. It eliminates the need for diagnostic tests and future visits. The answer is C, as it guides ongoing care and ensures consistent patient management. As follow up plans are critical for tracking disease progression, reassessing treatments, and ensuring the patient's condition improves or stabilizes, as documentation ensures effective care continuity and compliance. And here we come to end of this lecture. Thank you very much and goodbye.